You have, I think, the eighth largest market capitalization of any pharmaceutical company in the world. So your market capitalization is over $200 billion. Do the companies that are your size or bigger, do they have the same strategy of getting out of consumer, getting out of generics, or not?
For the most part, the trend in our sector has been to focus. So if you look at some of those larger companies, almost all of them, save two, I would say, have focused down over the recent years. And I think that allows you to grow. It allows you, of course, to have much more focused capital allocation. And I think it's going to be the current trend in our sector, because part of it is you also have to stay diversified in the science that you're in. I mean, and so to be diversified across sectors and diversified in science is really hard.
So last week, as we're talking now, last week you made another acquisition, I think for roughly $5 billion. You bought a company that is dealing with blood cancer. So
That's right.
why was that a good acquisition? And how long does it take you to make an assessment of whether an acquisition is good or not? And do you come up with the ideas yourself, or does some investment banker come along and tell you this is a great idea?
So we limit our use of investment bankers in general. What we try to look at is in the therapeutic areas we're in. So we're in blood cancers. We've been in blood cancers for over 20 years. Some of the most pioneering drugs in blood cancers have come from our research labs. And we say, if this is an area we're in, we have deep understanding, therefore this makes sense to actually add another medicine to that portfolio. And so we make that assessment. If it's a good strategic fit, in this case, a good financial fit, we'll make the bet. One of the things we've tried to be much more disciplined on is to try to go at the lower end of the range, so under $5 billion for acquisitions, and really ensure that they're in areas we have deep understanding. Generally, when we've gone too far away from our core, the value creation hasn't been there.
Last year, 2023, we saw an enormous increase in drugs being taken that reduce your weight, and they seem to work quite well. There are two drug companies, one in the United States and one in Europe, that seem to dominate that business. Are you going to get into that business, and why not? It seems to be extremely profitable.
It is a business we're interested in. We're working on really the next wave of medicines, because I think these GLP-1 medicines that you're talking about are very well serviced by the current companies. It's a fascinating story. It goes back actually to the early 1990s. It took us almost 25 years to realize the potent effect that these types of drugs would have on obesity. But we think there's opportunity to improve on them. And we hope it's very early stage within Novartis, but can we come up with drugs that better preserve muscle, are maybe easier to take and more infrequently taken? One area of where Novartis is one of the leaders is in what are called small interfering RNA therapies. It sounds like a fancy word, but really what it allows you to do is take drugs that you normally would take every single day and make them drugs you only have to take twice a year. So in cholesterol lowering, we have a medicine that you only have to take twice a year to lower cholesterol 60%. We're working on similar medicines for hypertension, high blood pressure, other risk factors for cardiovascular disease. And the idea is, can you get to very infrequently dosed medicines? Because most people don't stay on their drugs.
In 2023, AI burst onto the scene. Everybody's now excited about AI. But how is AI affecting your company, and do you think it's going to help your company?
I think AI is going to have a big impact, but I think it's going to take more time than most people expect. I think first, in productivity areas, AI has immediate applications. And I feel like in productivity, we can use AI for document management, document generation, not really sexy areas, but things that really tractable. In our sector, most uniquely, the big question is, can you speed up or increase the efficiency of drug R&D? And there we're doing a couple of things, working on clinical trials and optimizing our clinical trials. But the big bets we've made are with Palantir, Microsoft Research Labs, Google DeepMind, and a few other partners to say, could you really discover novel drugs that maybe weren't discoverable without AI? Can you optimize drugs much more quickly? And this is all building on the pioneering work that Google DeepMind did on a technology called AlphaFold. There's a huge opportunity here, but I think we also have to acknowledge that we only understand about 5 to 10% of what is going on in the human body. So to expect AI to use that 5 to 10% to extrapolate and come up with big discoveries is going to take time.